I guess we'll get going here. I apologize. Brooke, it's recording, right? I think it automatically said it was recording when I signed on.
That's right.
Yeah. So first of all, I apologize for the background noise. There's construction going on in the roof. What they're doing, I have no idea. So I hope that it's not as loud for you as it is for me. So I apologize. Nothing I can do about that. Secondly, we are recording this meeting, so your participation is an implied consent that you are okay with that. So just wanted to state that up front. Hi, Michelle. So let's dive right in. We'll probably have a few more people popping on. If you could introduce yourself in the chat, type your name, your affiliation. I have said hello to a few of you that I know already, but that's kind of the way we take attendance, which we need to prove that there's been collaboration going on in the region. So I appreciate you doing that. So while you're doing that, let's bring up the slides. Brooke, are you bringing up the slides?
Sure, you got it.
Okay. All right, let me just get rid of this here. There's too many things in front of me. Okay, so welcome. If you're just signing on, please introduce yourself in the chat, your name and your affiliation. That's our way that we take attendance, and we'll get going. So let's give a couple of quick updates. As you know, we're in the midst of working with the hospitals and the county health departments and also many community-based organizations to conduct a joint community health needs assessment in the region. And this assessment will inform the community service plans that hospitals will submit to the state at the end of next year, and for federal requirements as well. And the county's community health improvement plans, their CHIPs, that they will be sending off to the state next year as well. So we are approaching this from two different angles. We have a community-based organization survey that is circulating, as well as a community health survey to individuals. Why can't I remember what CHAS stands for at this minute? I did a song about it last time. Community Health
Assessment Survey.
Assessment Survey.
You knew that.
I went blank for a moment. I did my All That Chaz song. Although that wasn't on this call. That was on the CHNA work group call. So we had, we meet monthly. That work group meets monthly. We had our last meeting this Tuesday. Everything's moving along. As I said, we're really in data collection phase right now. One thing, of course, that we do ask you is for assistance from each of you is to push both those surveys out. If you haven't gotten the CBO survey, you will be getting it because we've been sending follow-up emails about that. As many community-based organization leaders as possible. If you could please complete that survey, it somewhat mirrors the community health assessment survey, which is that individual one. Both of these we're pushing out aggressively. If you can also push them out through your social channels, your e-newsletters, if you happen to have any in-person programs, paper copies are fine as well. Send them off to us. We will input those community health assessment survey data into the SurveyMonkey collection tool. The CBO survey, I believe, is just digital on SurveyMonkey. We've also provided on some sample posts and flyers for you to use with QR codes that might make it easier for an individual or a community-based organization leader to take the survey right from his or her phone, just scan it and get that completed. As you've heard me say before, the data that comes out is only as good as the data that goes in. So the more representation and the more data we collect, the better the analysis, the richer the data, the better the representation, and the more useful it is for each of you. Whether you are a hospital or a community-based organization, an academic institution, a county health department, and then some other type of organization, it's very useful data. So do you want to advance the slides, Brooke?
Yes, you got it.
Oh, okay. Along the lines of data and information that you can use for determining what programs make sense in your area and for your organization to present, to understand how individuals are thinking about health barriers, and social determinant of health needs. You may recall that the collaborative some years ago, in fact, it's almost 5 years ago now, I circulated an article from Health Affairs Digest titled Beyond Books. And it was authored by a researcher at the University of Pennsylvania who was looking at the Philadelphia library system and how well prepared the staff were there to answer the social needs questions and health questions presented by patrons, people. And as you know, libraries are a trusted resource by community members. They really are gems. They're a great community facility. And through the years, increasingly, individuals have turned to their libraries and have gone to library staff for assistance on employment, how to fill out employment applications, how to access SNAP benefits, how to fill out and find insurance, as well as needs around health, different types of screenings, blood pressure screenings, cholesterol screenings, and whatnot. So they really have been quite active, and that has only intensified in the past couple of years, and certainly the pandemic. Again, they remain a great resource for community members. So we got the idea with our academic partners that perhaps we could replicate the study, which is a qualitative analysis study, on Long Island, and look at the suburban setting of libraries. How do they play into this? And so after some conversation with the researchers at the University of Pennsylvania, we were able to sign on to their IRB, and we developed a project here for Long Island. Stony Brook University and Adelphi University, they were the lead researchers in both the libraries in Nassau and Suffolk County. We selected via a block randomization process. It was completely anonymous. It was voluntary and up to the hospital, to the libraries to participate. I think in the end, we ended up with 32 libraries, and they conducted about 97 interviews among library directors, reference librarians, front desk clerks, anyone who was interacting with the public. We recorded those interviews, and then they were transcribed. And then Stony Brook University, their researcher there led MPH students on developing a coding system. They used Deduce, a qualitative analysis software, and they analyzed the data for key themes, recurring themes, what were pressing issues, what was difficult for library directors and staff to address, etc. So we developed that report is now done. And the research is concluded, and I wrote a general report for the library directors and for the general public. And for the collaborative members. And it's another great source of research, secondary research that you can turn to. And it corroborates a lot of what we found in the community health assessment survey in terms of what the needs are. Mental health has risen to the top. as unfortunately it seems to be doing, and that's increasing, only increasing. And these were the 5 top identified needs in that library research project. We looked at both, as I said, health needs and social service needs. And so that is residing on our website. We can send it, we probably will send it out to everyone just so you have it, but it is on our website and you can take a look at that, and that's there for everyone's use. Thanks again to those researchers from the 2 institutions and the students who were involved in this. It was a tremendous amount of work. Thanks to all the libraries who participated. It was really a great example of collaboration at its best between the Long Island Health Collaborative, the libraries, the academic institutions, and even the academic institution in Philadelphia. So that's there for you to use and use as a reference. Okay. So speaking of libraries, we're going to, and because Stony Brook University was involved in that project, we asked our academic partners who have practicum opportunities in their public health program to talk a little bit about what they can offer, what their students can offer. The partners are interested in learning from among the community-based organizations and hospitals and others on this phone. What are the projects? What are your needs? And how they can fulfill those needs by providing very experienced professional students. Many of these students are already working and have professional experience. So you're getting a high quality student. I did serve as a preceptor for a couple of Stony Brook University students. It was a very rewarding experience. Once you have the project in place, there isn't much required of you other than to help guide the student. And it is, again, as I said, very personally and professionally rewarding. So think about it from that perspective as well. So we're first going to hear from Dr. Martine Hackett. I'm sure everyone knows Dr. Martine Hackett from Hofstra University. And she's going to tell us about her program. We also did, to make it easy, just before she starts for everyone, we developed on the collaborative website a page, landing page, which is a reference page that has an intake form that you, as an individual at a community-based organization or hospital or wherever you might be, you can complete it, note the areas that you're interested in, fill out your contact information, and then we will give that to the respective academic partners, and then they will reach out to you directly. So we're trying to streamline the process and make it easy for everyone. So that resides on our website. So I think now I'll introduce again, as I said, Dr. Martine Hackett from Hofstra University, and she will talk a little bit about the program that they have there at Hofstra University.
Thank you so much, Janine. Good morning, everyone. So I really appreciate this opportunity to share with you some information about our Master of Public Health program, and specifically looking for sites for our applied practice experience, which is what we call our internship. So Brooke, are you doing slides? Oh, next slide, please. Thank you. And so for our applied practice experience, we have 2 options for students. The first is sort of a traditional hours-based option. Students will do 150 hours and they will work on projects on site, remotely, with a preceptor. And so this is sort of a traditional model of working with an intern, and often these are students who are doing, looking for additional work experience, who are transitioning into public health from another career, and who also are looking to make those kinds of networking connections. And so this hours-based option, I should just also add, can start at different times, even though this course runs from either the fall or the spring semesters. Students could start in the summer, and so I think that, you think about this just in terms of the length of time it would take them to do 150 hours, and in general, the earlier they can start in the semester, the better. And so thank you. Next slide. The second option is what we call our portfolio option for the applied practice experience. And basically the way that this works is you want to think about 2 products that the students get out of their time working with you. And so a product, as you can see on the slide, can be a survey, it could be a video, a resource guide, you know, something that if you could imagine that they would actually put into a portfolio. And so the way that this works for on our end is that students need to meet 5 competencies that the products that they developed are a demonstration of. And again, the sort of way that they would work with you are, you know, could be, it's less sort of, you know, supervisory in, versus the hours-based option. But again, the idea is you have a product in mind, you have something that you're really have been sort of looking to be able to create, and that the students would be able with guidance to be able to help to create that. Yeah, so that's the other option that we have. And next slide, if there's a next slide, maybe. There isn't. Maybe.
I believe that concluded.
That's it. Okay, yeah, because I can't imagine there's anything else I need to say, except that we are happy to, I've already actually, Janine, have had interest from the original email that you had sent out. So I really appreciate people's, you know, ability to take one of our students. And I should also add is that on our side, we're also providing support for the students as well as they're creating these projects. So thank you.
Thank you, Martine. Yeah, you know, don't be afraid. I know sometimes we as professionals like, oh, we have to supervise an intern. Oh, we have to supervise a student in a practicum. Don't be afraid of that, because the assistance you will receive and the help that you will receive far outweighs any kind of guidance that you might have to give. And I know that for a fact, because we're going to hear from our next presenters, one of whom did intern at the Long Island Health Collaborative, and then we hired her, and then she moved on to Stony Brook University. So I obviously she did great work when she was here because she was hired by Stony Brook, but it was a great experience for me personally and professionally as well, and for her. So we will next hear from Stony Brook University, Michelle Bailey, who is the practicum coordinator, and then Pascal Fizame, who is a former LIHC employee. She's the practicum placement and community engagement coordinator. So I'll leave it to you two.
Great. Thank you so much, Janine and Brooke, for inviting us and coordinating this opportunity for us to share information about our practicum. As Janine said, you are probably familiar with Pascal. She's been not only an employee, but also active for LIHC. I am new to Stony Brook. I started this semester, so I'm very excited about working on the practicum, as well as I am one of the faculty in the MPH program. Great. So just wanted to give you an overview of our practicum, as well as expectations and what you can hope to gain from working with one of our students. So for our practicum, it is a hands-on experience for the students. They have to allocate 135 to 100 hours working on the practicum, and that really is dictated by their area concentration. For the most of their concentrations in our MPH program, they will actually work 135 hours on their practicum. For the health policy and management, it's actually 100 hours because there are other requirements. The practicum is really an opportunity for our students to apply the knowledge and skills that they have gained from their involvement in the program. A lot of the students opt to register for their practicum towards the end of their program. And so they have built a number of skills and really have a good sense of the theory around public health. The practicum is conducted in partnership with an agency or organization that provides a public health service. And so we have the students who are eager to work with the organization, and they partner with the organization, and our practicum as well as our program, it's accredited by the Council on Education for Public Health. And so some of the criteria and the description of our practicum really aligns with the requirements of CEF. Next slide, please. Okay, I wanted to share with you the expertise of the students who actually opt for, or who actually will be completing the practicum. So we have a number of dual degrees in our program. So a student can be an MD dual degree, DDS, Masters of Social Work, MBA, certainly the applied policy and practice, and also an MS in nutrition. And so our students, in addition to bringing expertise in public health, they bring expertise in other disciplines. Our students are paired with a practicum advisor, and this is someone who is part of our core programs in public health faculty, who will guide the student and provide them with any type of assistance they need and support. The preceptor, which will be a point person at an organization, the practicum organization, and then the practicum coordinator, myself, with the assistance of Pascal. Pascal and I, we work as a team in supporting the students who are completing their practicum. You go to the next slide. So in terms of our expectation for the preceptor, and I'm so happy that Janine prefaced it by saying that it's not a task that should be. It's not a task that will be something that will really overextend you as a preceptor. But what we're looking for is someone who can provide guidance on developing the proposal. All students have to submit a proposal on their practicum, which outlines the goals and objectives of the practicum, a description of the organization they're working with, what competencies will they gain from this experience. The students, as I mentioned, they will provide up to 135 hours of unpaid experience. And so that's another benefit of this program, that you do not have to allocate any financial resources for the student. They will actually earn 3 credits for this experience, and so it is an unpaid experience. We expect the preceptor to orient the student to the organization, the policies, procedures, anything that's relevant to that person's work. In addition to the student working on the practicum and specific deliverables, we hope that this will be an opportunity for the student to network with professionals to really get a sense of the organization that they're working with. And so we look to the preceptor to be able to provide that support. Also, as the student is completing the practicum, we would like the preceptor to check in with the student, make sure that they are on task, provide any guidance that they need in completing the practicum, and at the end to evaluate the student's performance, which is really key for this experience, for the student to get that feedback, as well as for us to get the feedback. We do review all performance evaluations. We also reach out to the preceptor just to make sure that the student's on track and to get some feedback about the experience. Next slide. Okay. I've sort of peppered the presentation with some of the benefits you can hope to gain, but just to go over some of the types of projects that our students work, that our students are able to deliver. They can work on grant writing, data analysis, policy analysis. They can actually develop programs. They can actually facilitate programs. What the students have to do is to deliver 2 agreed upon products. And so it could be an analysis of data that you have with a report, needs assessment. It really runs a pretty broad range, really dictated by what are the needs of your organization. How can you best utilize the skills of a student, and we also look to align the student's interest with the practicums that the preceptors may have available for our students. And so those are the two things that we look for: aligning with the student's interests and their career trajectories, and what are the needs of the organization. And like I said, it's a pretty broad range of projects that the students can work on, and the work is polished and is professional. As we mentioned earlier, a lot of the students come with other experience. Their backgrounds are pretty diverse, and so in addition to bringing their expertise and knowledge in public health, they're able to bring expertise and knowledge in other areas. I believe that that is our last slide. Yes, and so here is our contact information. We're really pleased to work with any of you who are interested in partnering with us. We've already have been contacted with some interest. So thank you, Janine and Brooke, for already getting the message out about our practical program. And so, yeah, thank you very much for this opportunity.
Thank you for telling us about this. It really is a win-win situation. You can't go wrong. It really is. It's quite helpful. And the students in any institution that I've ever worked with are very professional. They're eager to learn. And it's a great feeling to know that you are educating the next generation of public health professionals, because we're certainly going to need them as we move forward. Adelphi University also has a practicum experience that they offer through their Master of Public Health program. Natalie Madre is the contact person there. She was unable to join us. She was supposed to, and something happened and she couldn't join us. But she does have a few slides. They are available on our website, but I did just want to call attention to the fact that that is available as well as another option if you're interested. I think I should stop here and see if anyone has any questions for Martine or Michelle or Pascal about the programs. You can just unmute yourself and ask a question. No questions?
I'll just say thank you for your presentations. They were really
Yes.
insightful.
I think we have some folks on the line who've hosted as preceptors. I don't know if they want to share as part of this is a good idea to everybody else, if they'd be willing to share their positive experience with having a practicum project at their organization. So if anybody's on the line that is willing to give a shout out to any of the organizations, I know we've placed students and perhaps Hofstra has as well. So I'll mute myself, but I think it's good for others to know what the kind of the burden is. Is there a burden, or is it all just goodness?
I have to say, in my experience we have the preventive medicine residents that are getting their NPHs, and they do phenomenal analyses for us. Like, they're on SPSS, they do mapping projects. They have done so many really productive things that have helped us with our goals and mission. And so we really appreciate having help. We have an MPH student who's not a preventive medicine resident also, who's helping us with a community education project. So we're really benefiting from.
Great, thank you, Linda.
I'm going to ask, it's kind of this is Dr. Mike Miles. I'm from Eastern Suffolk BOCES. This is maybe an out-of-line question, but in psychology or any of the, I head up the mental health crew. I do have I'm about to be hiring a public health nurse who's a nurse practitioner. But for most of the other professions, for licensure and other things, usually the field instructor or, person who's providing it has to be within the same discipline. Is that true for this as well? Or would that be, because this could be a great service for us, because we, one of the programs I run is an employee assistance
It's
program.
about the mission of the organization. And if the mission is in line with the mission of our programs, which is to improve the population's health. So if that's that aligns with your mission. And we do want to make sure that the preceptor is appropriate to supervise the work. But if they're not specifically trained in public health, even more exciting for a student to be exposed to social work and mental health professionals and
Psychologist,
other
yeah, that's the-
professions.
Okay, good. All right, thank you.
Lisa, they have to be, and Martine, they have to be, have at least a master's level of education to be a preceptor, correct?
Well, SEAF doesn't require that, and
Okay.
we value work experience. And so again, the first thing we look at is the mission of the organization.
Mhm.
And also what is the need and the opportunity for the student to produce at least 2 deliverables that would help
Mhm.
further the mission and apply the more advanced master's level skills that they've acquired as part of their training. So
How about-
no, they
okay.
do not have to have a master's degree.
Okay, is that the same for you, Martine?
Yes, and so the really the requirements are that the projects or the products that the students create meet the competencies of what
Mhm.
students are able to do. So whatever that looks like, you know, at whatever kind of agency and whomever is supervising that, it's really about sort of how the students are applying the skills that they have learned to create those final products.
Yeah. Okay, I just see a comment here from Nahid Khan that the students are wonderful and they absolutely would love to collaborate and coordinate with the universities on this. Again, I can't say enough about how helpful it is to have one of these interns working on a project or a couple of projects. As a preceptor and as somebody who wears just quite a number of hats here, not only the collaborative, but through my association, the Nassau Suffolk Hospital Council, that oversees and manages the collaborative. I am extremely pressed for time, and this has not been a burden in any way whatsoever. And it's actually, I've learned a little bit along the way, particularly in the data analytics part. We had one young man who was great in mapping and data analytics who interned with us, and he was a great help. So again, don't think that this is going to take up a lot of your time. You do have to give direction and you do have to be committed, but it is not all consuming. It is an absolute win-win. And I highly, highly recommend that you look at your organization, what your organization's needs are, contact any one of the practicum coordinators and discuss what you might have available, and they'll present you with a phenomenal student. Okay. If we don't have any more questions, we'll move on to the next agenda item, which is about the 1115 Medicaid waiver, right? So kind of informally, everyone calls it what, DSRIP 2.0, which is not really what it is, but it kind of got that moniker there along the way. The Medicaid waiver, CMS has formally asked New York State to submit an application. I believe tentatively that application is going to make its way to the feds in January. But be that as it may, we're still many, many months away from anything being final in that Medicaid waiver. If you've looked at the concept paper, and I'm sure most of you have, and if you haven't, you can easily find it on the state's website, State Department of Health website. They are very much focusing, looking at population health, the different social determinants of health. These are key influences shaping the state's application. And as the Long Island Health Collaborative is a former FIP, which is a population health improvement program. We were funded by the state under that program, which was separate from the initial DSRIP. But I know the state is very keen on the work that can be accomplished through collaboration and a population health-based approach. So it's very interesting as this plays out over the next year or so to see which way the federal government is going to go with this, if they accept the waiver and whatnot. And then once it's accepted, then hopefully it's accepted. there's a whole process then to put it in place. So we are quite a ways down the road before anything happens. The initial ask was 17 billion that the state was asking instead for the Medicaid waiver from the feds. I think that might have dipped down a little bit, but my last sources tell me that the state realizes that, but they're going to kind of stick to that number anyway. So that's the news I have on the Medicaid waiver. I'm happy to try and answer any questions if anybody has any. I don't, or if anybody else on the line has more information than I do and you'd like to share that, I welcome you to do that. So I'll just stop there and see if anybody has anything to say about this.
Janine, I'll jump in. So I just also want to let everyone on this call know that the Health and Welfare Council of Long Island is convened a group called HEALY, the Health Equity A of Long Island. I don't know what the A stands for, but it is a group that is actually is focusing on the 1115 waiver and thinking about things like what kind of advocacy can we do on Long Island to be able to get the share of the funds, to also think about what does that look like in terms of the structure, putting people in the center versus sort of the hospitals in the center, as was done with the district, the previous district. And so there's a lot of work that's happening there, work around community health workers actually, and developing that as a structure here on Long Island, thinking about what that would look like in terms of contracting for community-based organizations. So I encourage anybody who's interested in that to contact me. I'm on the steering committee, or to just look at the Health and Welfare Council of Long Island's website, because there are monthly meetings where they are working on this.
That was Martine, correct?
Yes.
Yes. Yeah. Yes. And we've also been in conversation with the Health and Welfare Council about this, because there is strength in numbers. So I think we're going to see what kind of a collaboration can occur down the road. There are two components of the waiver, two entities. One is Social Determinant of Health Networks, called SDHNs, and the other is called HEROES, because you know how the state loves acronyms. Forgive me, I don't remember what HEROES stands for, but I know that this waiver is not going to be hospital heavy as the last one was, and I think the HEROES is the HERO entity, whatever that ends up being, is going to serve more as kind of a planning organization and kind of direct what the region should do or could not do. And I'm not really sure how the funds are going to flow yet. And again, it's still being shaped, right? The state is still putting this whole application together. And then once it goes to the federal government, they'll take a look at it and they could decide to, well, this doesn't make sense and throw that out, or we want you to do this, or we don't want you to do that. So it is still a way, has a way to go. I believe also there's an emphasis on homelessness and housing in the concept paper that I read. So that'll be interesting to see how that plays out. But yeah, so, we'll keep you apprised of what's going on with this. I think once it gets to the federal government and they start taking a look at it, and then there's communication back and forth, it could move a little more quickly when it gets to that point. It's just that it probably won't be until sometime middle of next year, maybe toward the end. But that's where we're at with that. Okay, so I told you that this was not going to take the whole time, so I'm very happy. We're not done yet. We're almost done, but I'm giving you back some time in your day, which is my holiday gift to everyone. So I'm sure you're pleased with that, and I hope you're pleased with that. So I just wanted to talk about 2022. I cannot believe it's going to be 2022 in a few weeks. I cannot believe we're still in the midst of this pandemic the way we are, but we are. But anyway, we're going to remain hopeful, and we're going to say that all good things are going to happen in 2022. Here at the Long Island Health Collaborative, which, as you know, had been funded by the state through that population health improvement program, which was a 5-year program. That ended in March of 2020, coincided with the start of the pandemic. Isn't that funny? That ended in 2020. And we've been able to, through the Nassau Suffolk Hospital Council, has been kind enough to allow me to continue to oversee this initiative, to continue to build our extensive partnership and member collaboration. I think it's like 350 organizations at this point, because we realized that we built something that was very useful and continue to hold meetings. I still have great attendance at the meetings, so I think that tells me that it's helpful to everyone. So I have been able to, without any funding, continue to oversee and manage and provide this coordinating body for everyone in the space of population health. So given that, we will continue to collect the data and analyze the data. We are working with a consultant data analyst that I was able to find so that we can get the data analyzed and continue to give you those reports that you've come to rely upon. There's continued opportunities for partnership. Our programming, we've had to scale back, as I said, because there is no funding and because it's just Brooke and I, and this is not all that we do here. But we do still hold a number of programs. One of them is the Walk with a Doc program. And before the pandemic, we were holding that on a monthly basis. It's a great opportunity for any hospital, any public health agency or community-based organization to partner with us and provide a health expert who can talk about a health topic, if it's diabetes or hypertension, whatever it might be, and then lead participants on a walk. We've done a number of these. We still held some outside during the pandemic with one of our partner organizations, and it's been going well. So there's that. We do all the work. So all you have to do is say, yes, we want to hold a walk with a doc. It's an actually national organization. And we established a chapter for Long Island under the Long Island Health Collaborative, and we do all the work and we'll work with you on that. I hope to have refreshed Sparks, that's the hospitalization data, available next, probably March, April of next year as well. Sparks data is data that is looking at discharges by diagnoses, different diagnoses codes. And the Community Health Assessment Work Group in the past has determined what codes we should look at. And so we'll be looking at those same codes, but we're going to do a refresh and look at the select communities in a little bit of a different way. But more about that at the next meeting. And finally, again, about collaboration, we are on the verge of entering into a collaboration with AARP of Long Island, which is something that I've been trying to do for quite a number of years. I don't know if anybody from AARP is on the line, but this I think will be great for everyone, because we all know that the high users of health services are those 50 and plus, because age is a factor in disease, particularly chronic disease. And so we're going to collaborate them on a Talk with a Doc webinar series, and then follow that up with 2 major walks, one in Suffolk County in the summer and one in Nassau County in the summer. And we are reaching out to hospitals and other organizations who have physicians and leading health experts to lead that series of webinars. They'll be very brief, half hour, 20 minutes, very high level or very generalized information for the audience. And then that will hopefully build interest and momentum for individuals to participate in the walks that will take place probably in August. But we are in the midst of that. We're going to be sending in a formal application to AARP before the year is out. So we're rather excited about that, that collaboration. And there is a chance, because I don't want to promise anything. I don't count chickens before they're hatched, right, Pascal? You heard me say that so many times. that our walks will be included in ARP's magazine under the New York section, events section. So that's great exposure for any organization that wants to get involved in that. I think that's all I had to say. Opportunities project. I talked about this previously. Alliance Health Communications. It's as if Brooke and I don't have enough to do. I decided to establish a service line, specifically a health communications, offering writing and social media campaign design, et cetera, full service communication services to the not-for-profit community, because we had been asked by many organizations to help them out. And I realized, well, gee, maybe there's a need here. And so I wrote a business plan, developed Alliance Health Communications. It is a service under the Suburban Hospital Lines of New York State, which is part of the Nassau-Suffolk Hospital Council. And we have this, we started this back in June. We've gotten a couple of clients without really even advertising. We have extremely competitive rates. I like to say very, very skilled communicators in the health communication space and public health space. And I just wanted to remind everyone of that, that's available. And our quarterly meetings, we have already scheduled those for next year, and you'll be getting an Outlook invite, so you can keep an eye open for that. You might have already gotten it. I think they already went out.
It will be going out before the end of this week to everyone.
Okay, we're going out before the end of this week. Okay, so yeah, that's it. So did I miss anything? Does anyone have anything they want to talk about? Any like astounding ideas that come to mind? Any collaborative ideas? We're always open to collaborating and leveraging the partnerships we have, and helping one another out. It's kind of what it's all about. We follow the collective impact model, right? Which kind of serves as that backbone. We're here to convene, to do data analysis, I think the practicum, talking about the practicum, is an example of what we can do as an organization. As a backbone, we can kind of centralize and streamline that process and then make it easy for everyone else. That's what we aim to do, is to make everything as easy as possible for everyone.
Hi, Janine, I have a question. This is Janet Romeo from the Epilepsy Foundation of Long Island.
Hi, Janet.
Hi. I just have a question. By the way, I wanted to give kudos before. This is on another note, and didn't get a chance to chime in, but to Nahid Khan and the Community Health Worker Program at Nassau Community College, which we have worked with very successfully, and a great partnership. So kudos, Nahid. So my question was, I just can't remember, I'm getting old and I just can't remember, is there a county-wide health and welfare fair, expo of any kind?
Well,
There hasn't
nothing's
been recently. There used to be something, and I think it might have been organized by the Suffolk County Office of Minority Health and Health Disparities.
Okay.
And I believe it was held at one of the universities, but since COVID, we haven't come together like that in a few years. So we could ask Edesua, excuse me, from the Suffolk County Department of Health. That's my memory, but it's been a few years.
Okay.
So that's something we could look into. I feel like, one of the things I wanted to say is just the positivity rates are really, really, really shooting up.
Yeah.
So in our various roles, I think it's very important that we continue to be vigilant about encouraging boosters
Right.
and masking and distancing because going into the holiday season, I mean, I'm on the Worldometer right now this second, and the rates, especially for Suffolk County, have really gone up. So I just
Yeah.
want to ask everybody to, I know we're getting tired of it, but it's not tired of us, this virus. So
No, that's a great point that you bring up, Lisa. Yes, boosters, vaccinations, if you haven't been vaccinated yet, encourage as many people as you can. There's still a group of hesitant individuals and people who are just dug in and do not want to get the vaccine.
or
And
don't want to
regarding
get the booster. They're just done
they-
with it.
But yeah, but sometimes there's many that haven't even gotten the initial vaccination yet.
Yeah.
And
that's where, if I may, and that's where our cultural sensitivity and our cultural competence come in as
Mhm.
far as educating. And I think as professionals, we just can't forgive that we talk it, but now we have to apply it. And how can we, reach those who don't understand through education, through simpler language, through
Yeah.
modeling? So I know it's easy to say everybody, and that's what I work with in the Medicaid care coordination. And it's working through patience and education and example, but we just can't keep, pulling the hammer, get it done, get it done. It's just a little bit more than that.
is that Harriet speaking?
Yes.
Hi, Harry. Okay. Yeah, I mean, I've been involved in and still am involved in several vaccine equity and vaccine distribution task forces, local and state. And a lot of the research that I've looked at, what is most beneficial when you're working with some of those communities is the faith-based leaders. They have inherent trust among the community members, and they're key to make those connections. And one-on-one, it really kind of comes down to one-on-one conversations.
I don't know if it's helpful. We have a recorded conversation with Doctors Piggott from Suffolk and Dr. Eisenstein from Nassau, answering questions that were sent in from the public, explaining, why are antibody levels not a great tool? How long should you wait after you are confirmed to be having had COVID before you were to be vaccinated? Can you get the vaccine at the same time as the flu vaccine? So, Janine, do you feel comfortable posting that or sharing that with the LIHC?
Yeah, sure. We
I'll
can
send it
share.
to you. It's on the Stony Brook Medicine website.
Yeah, we can share that. There's also been a tremendous amount of materials produced by the Hub organization, which was all of the hospitals and community-based organizations, the counties, etc., who were responsible for overseeing the distribution of the vaccine when it was first, about a year ago now, right? December, just about a year ago. And they also had a subcommittee, a health equity subcommittee, and they've done a lot of work around educating how to reach these communities of color, different ethnicities, different cultures. So that they've done a lot of work in that area. And it's really, from everything I've read and all that I've heard and all the committees I've been on, it does come down when you've got somebody who's really resistant, is one, certainly if there's a family member or friend who contracts the virus, that kind of scares them somewhat. But listening one-on-one with their physician, having these really heartfelt conversations, and it oftentimes pushes them over the edge. But there's lots of information out there. We had the Nassau Suffolk Hospital Council had a campaign. Have you heard? Immunity is the word. We've been pushing that. The Ad Council has fantastic information on their website. Different PSAs that are provided by different ethnic groups and faith-based leaders and whatnot, that it's all open source and you can pull and use and post on your own social media platforms. They've got excellent materials they developed. So there's been a lot, but it is, we're all getting tired. We have to just we're kind of like at the marathon, right? Where you're at, well, I don't even know if we're at the end, but we're coming toward the end. and we're getting all those muscle cramps and we're really tired and we don't think we can go on. But we have to, because we're never going to come to the end of this if we don't. So, yeah. So
The links to the video Lisa was mentioning are in the chat.
yeah, I saw that.
Thank you,
I saw
everybody.
that. Yeah, the health commissioners are great, particularly Dr. Piggott. I think he really connects well with the individuals, and I've used some of his examples. He talked about when the people were concerned about the mRNA vaccines, like how did they work? And he gave a very simple analogy that it was like a if you ordered through the mail some kind of an apparatus that arrived in a box at your house, and it came with instructions to put it together. He says that's what the mRNA vaccine does. It gives the body instructions as to how it needs to fight this virus. Actually, I thought that was pretty simple, straightforward, culturally appropriate language, or health literate language to use, simplified. Any other discussion? Look, say it's only an hour. I gave you back an hour. How about that? Well, I wish everyone a happy holiday, whatever you celebrate. I wish for an end to the pandemic and all good wishes and health and happiness for the new year. Reach out to us at any time. We are always willing to help out, collaborate, do whatever we have to do to move and improve health forward and improve the health of Long Islanders in any way, shape, or form. And thank you to our presenters. Thank you so much.
Thank you.
Take care.
Thank you, everyone.
Thank
Thank
you.
you.
Bye-bye.
Bye.
Bye, thank you.
Bye-bye.